Welcome back. Welcome back to Living in Mexico. I'm Ana María Salazar. Thank you. Thank you so much for joining us. Well, I got to tell you the story, and I know a lot of families are living through this. My son the last couple of days wasn't feeling very well, and finally I took him to the doctor. The doctor suggested that he be tested for both COVID and influenza, and he came out positive with influenza, and of course he's getting appropriate treatment. But I found out from this doctor as I was talking to him that there's a lot of people getting very sick. And I guess there's an expectation of more kids getting sick as we get closer to the end of the year. That's why I really appreciate today's guest. He's been joining us throughout the years, Dr. Mauricio Rodriguez Alvarez. You know him well. He was a spokesperson for the university, for UNAM, throughout the COVID-19 crisis. And of course, he's always helps us understand trends, trends in Mexico and Mexico City. Dr. Mauricio Rodriguez, once again, thank you so much for joining us.
Hello, Ana Maria.
So it's
Thank
great
you.
to talk to you. I mean, I
Yeah,
get,
thank you
is
for
there
having me again.
what is going on in Mexico right now? I mean, in
Yeah.
terms of COVID and influenza.
Well, actually, we are seeing in the northern hemisphere an increased activity of COVID and influenza.
Mhm.
And I mean, according to the season, we are approaching to the season. And what you have described is what we will start seeing in the coming weeks. We
Mhm.
will start seeing the first cases, the transmission of the virus, and we will start listening people sick around us because the season is starting. So
Mhm.
that's what we should expect for the season that is. I mean, it's starting. We said
Mhm.
in October, by the end of October, the influenza season and COVID season and syncytial
Mhm.
respiratory virus start. So we should be prepared, and that's why we we are going to present what we are doing in the university next
Well,
week.
let's talk about that because the UNAM has an extraordinary program right now. It's for people who live in Mexico City, but it's just a reminder, one, how important UNAM is
Yeah.
in terms of the role they play in Mexico's health policies. But more importantly, it's doing it at a time where I don't know if it's more difficult or not to get vaccines, but at least
Mhm.
there's one place where everyone can go and get their
Exactly.
vaccines. Tell us.
Well, that's the idea. Actually, it's a group of institutions. It's not only the UNAM. It's all the health sector actually in the city. I mean, it's the Ministry of Health, the Office for the Vaccines in the country, the Ministry of Public Health from Mexico City, the Coyoacán major, the LIMS, no, the Mexican Institute for Social Security, the ISTE, Medical
Hmm.
Services for Pemex, of course, the university with a lot of internal participation, the
Hmm.
Sedena and Marina, they are also
Hmm.
uh, helping with
Hmm.
something. Uh, Each institution is giving
Hmm.
something in order to have this macro vaccine center in
It's a
the.
macro, let me just understand
Yeah,
correctly. So it's a macro vaccine center.
exactly,
Uh,
for the season.
mhm.
And we are going to use the vaccines for the season, for this winter
Hmm.
season, which is influenza,
Quinza?
seasonal seasonal influenza, COVID,
Hmm.
and pneumococcus.
Hmm.
And we will have a special line for measles, which still being a problem, and we will continue the vaccination
For,
against
mhm.
measles. But these three vaccines for all the people that want, and
Hmm.
they must go there and check there which of the
Hmm.
vaccines they need, and
Hmm.
they will receive for free. They don't need
Hmm.
to be part of the of the university. If you let me, I can share with you
The
the
information.
image of the I mean the flyer that we are
Hmm.
saying. Uh, if you don't have a vaccine card or a vaccine record, don't
Hmm.
worry. If you don't have an ID, if you are not Mexican, don't
It doesn't
worry.
matter.
It doesn't matter. The vaccines are for
Hmm.
all. And the idea of this effort is from Monday to Friday from 9 to 3 p.m.
Hmm.
Uh, we have a lot of parking lot. We are
Hmm.
very well connected. I mean, it's a perfect
Hmm.
zone for the
Hmm.
people in the south of the city.
We're
For
literally anybody who needs these vaccines. I think it's just it's an extraordinary opportunity. What
Yeah,
dates? What days is this going to go
it's
on
from
till?
from Monday 10 to Friday 14th
Hmm.
November,
All next week.
all next
Now,
week.
and it doesn't matter whether you are Mexican. It doesn't matter
Exactly.
if you
I-
have belong to the national health system. It doesn't
Don't
matter if you
yeah, yeah,
belong to
yeah.
that.
Don't
You
worry,
just
don't worry.
go and try to
Exactly.
get a vaccine.
And the idea is actually to help the institutions
Hmm.
to advance in the coverage of the vaccination as much as we can together
Wow.
during those days. We are expecting to have like 100,000 doses in those days. I
Wow.
mean, it's
Wow.
it's a
It's a
lot.
big deal.
Yeah, it's a big deal, but we are confident that the team is in place, and
Hmm.
we have the previous experience. I don't remember if you were aware. In September,
Hmm.
we did a macro center for measles vaccination in the same
Hmm.
place, September 17, 18, and 19,
Hmm.
and there were almost 50,000 vaccines in those days.
Hmm.
And because these vaccines are more um, accepted by the population, and people people know when they need the vaccines because
Hmm.
they use them every year.
Hmm.
Pneumococcal vaccine is for people from 60 and older. If they don't have background at least 1 year from the previous vaccine against
Hmm.
pneumococcal,
Hmm.
they will receive that. And COVID, it's also for, I mean, we will practically we will be putting the vaccine to all the people.
Hmm.
Uh,
So let me ask you this. What let's talk about measles because I know
yeah,
there is a concern that
absolutely.
started in the United States when
Yeah.
suddenly there was these we started seeing more and more measles and it became a political issue in the United States, particularly in Texas, and everybody once again we're talking about vaccination and we're not going to go into the decisions made
Actually,
by
the
the US
the problem
government.
started in Canada.
Oh, really?
Yeah, yeah, yeah. From there was a convention for this religious group in Canada, in
Wow.
Ontario,
Uh-huh.
and they uh, make the all the contagious to the people from Texas and from
Hmm.
Chihuahua, Mexico,
Right. And these are
and
people who don't
there start
vaccinate. Or
exactly.
this was a group of people who doesn't believe in vaccinations. So
Yeah.
what is happening in Mexico right now?
Well,
How concerned should we be?
we are really concerned because uh, perhaps we will reach the first anniversary in
Hmm.
February next week, next
Hmm.
year. And so far, I mean, the outbreak started in February this year,
Hmm.
and we have 5,100 cases in the country.
Hmm.
We haven't had such number since 1991.
Oh,
Okay,
that's okay.
that's a lot because
Hmm.
in 1990 we had an outbreak, fury outbreak,
Hmm.
60,000 cases,
Hmm.
something like that.
Hmm.
And in 91, we have 5,000 cases.
Hmm.
Uh, and also in Canada, they are having the worst outbreak in the last 40 years.
Wow.
Also, more than 500, 5,000 cases. Actually,
Hmm.
they have 5,100 cases.
Hmm.
And in the United States, 1,600 cases, which is also
It's
a
high.
huge
It's
number
big.
compared with
Hmm.
the
But
previous.
what worries you the most? I mean, because, people who
Mhm.
don't believe in vaccines basically are
Yeah,
saying, well, people don't die of this, or very few die, and there's just this fear about the vaccine. I mean,
yeah.
you and I have
Well,
talked about this before.
what we have seen in this outbreak in Mexico, actually, it's an epidemic composed by several outbreaks.
Hmm.
The We have outbreaks in 27 states. Okay. The main outbreak is, of course, in Chihuahua. Yeah, that we cannot deny that.
Hmm.
But we have seen people from Chihuahua
Hmm.
and a lot of transmission from Chihuahua to
Hmm.
other states. So
Hmm.
we can understand perfectly that the people from
Hmm.
Chihuahua that has not vaccinated during years,
Hmm.
well, they are susceptible and you
Hmm.
can just wait in order
Hmm.
for the virus to get them. But
Hmm.
the people that work with them and
Hmm.
they live in the indigenous communities in
Hmm.
Chihuahua or in Sonora. They get the virus and move it through their communities.
Hmm.
And the jornaleros, the workers that are
Farm
working,
workers. Yeah.
yeah, the
Hmm.
farm workers, they are moving all over the country during all the
Hmm.
year, and they are not vaccinated as we expect, and
Hmm.
that is one of the populations most affected now.
Hmm.
And we have seen the virus already in the big cities,
Hmm.
in at least in Guadalajara and Mexico City. Actually, this week was confirmed one more case in Mexico City. We already have 7 cases,
Hmm.
and
Seven
of
doesn't
course,
sound like a lot, but it's
yeah, seven.
very worrisome.
Yeah, it's very worrisome in a city like Mexico City with
Hmm.
a lot of connectivity,
Hmm.
mobility, crowded places. I
So
mean,
it
the risk.
sounds like you and your colleagues are expecting that we're going to have an uptake of measles in Mexico City. I mean, it seems almost
Mm,
inevitable or not.
Not as I mean, not an increasing number, but a constant transmission of the virus. I
Okay.
mean, not like in Chihuahua. I
Hmm.
mean, they have uh, 4,000 cases in Chihuahua.
Hmm. Hmm.
That's a lot for
Right.
one place.
Hmm.
In Mexico City, we just have 7 cases, but
Hmm. But
perhaps,
how worried should parents be? I mean, because ultimately, and tell me if I'm
well,
wrong,
yeah, yeah,
if
yeah,
you're vaccinated,
exactly.
you're going to be okay.
If you vaccinate your children, you don't have to be worried.
Right.
And what we are seeing now is that the population group from 20 to 49 years,
Hmm.
they don't have protection. Actually, they are being called to have a booster dose of
Oh,
measles vaccines.
really?
Yeah, yeah, in all the
Not.
country,
Uh-huh.
because the people from 20 to 49, they are
Uh-huh.
especially vulnerable because of
Hmm.
their individual history or
Hmm.
their cohort history, their
Hmm.
generation history. People
Right.
older than 50,
Hmm.
they were exposed to several outbreaks during the 1980s and
Hmm.
70s
Hmm.
and perhaps and the first years of vaccination. So they
Hmm.
have protection. But
Hmm.
people younger than 49 and younger,
Hmm.
they must receive one dose, especially if they
Hmm.
have children, if uh, they teach or they travel. I mean,
Hmm.
their risk could be a little
So,
higher.
so in this macro vaccination center, if you are in that category, will you
Yeah,
be able to get those
of
booster
course.
shots? Okay,
Sure, sure,
those
sure,
booster
sure.
vaccines. Okay, that's
Yeah.
really interesting to know. So,
I mean, the worst scenario could be that you will receive measles, influenza, and COVID.
all at the same time, and you will
Yeah,
survive.
exactly. Of course, yeah,
And
you will.
well, it's better than having to go to three different places to try to get
That's the
these
idea.
vaccines.
People, yeah, people complain a lot that where can I find the vaccines in my in my healthcare center, in my
Mm-hmm.
neighborhood, there's
Mm-hmm.
no vaccine. So
Mm-hmm.
we said, okay, we will have vaccines here
Mm-hmm.
from 9 to 3, from Monday to Friday,
Mm-hmm.
and if they are lucky, on Saturday.
Mm-hmm.
But from Monday to Friday, vaccines will be there, and we are.
I'm not sure. I don't think even in the United States, maybe in some European countries, but even in the United States, that they're doing these types of
No, they don't.
programs.
They
They don't
don't.
because of the whole debate, especially around the vaccines in
Yeah,
general,
and
right?
yeah, and in the United States, they have this uh, chain of distribution
Mm-hmm.
through the pharmacies and I mean, this change of pharmacies in the
Mm-hmm.
stores and in the, I mean, it's different because you can find the vaccines which are included in the public
Mm-hmm.
vaccination
Mm-hmm.
campaigns.
Mm-hmm.
But these efforts are more for internal communities.
Mm-hmm.
I'm sure several universities or
Right.
companies,
Mm-hmm.
they call their employees or the
And they tell them to go
students.
get one or
Yeah.
suggest because they can't force
But this
people to
is
have
this
a
is for
vaccine.
all the population. I mean,
Yeah.
anyone
So, so let me
can
ask you
go.
one last question. Once again, remind us
Yeah.
who should get vaccinated for influenza,
Okay.
pneumococcal, for COVID, because
Mm-hmm.
even that, as you know, in the United States with the new, there's new policies regarding these
Yeah.
vaccines,
Yeah. Yeah. Yeah.
and I believe that Mexico has a different position, right?
Yeah.
What
Well,
are what are, who
in
should get
Mexico,
vaccinated?
yeah, and let me tell you that this year
Mm-hmm.
Mexico is using the COVID vaccine for children from 6 months
Mm-hmm.
to 5 years, which in the
Okay.
previous years we didn't use that vaccine in that
Mm-hmm.
population.
Mm-hmm.
This year we are using the Moderna vaccine, which is an
Mm-hmm.
updated vaccine. We
Mm-hmm.
are using the seasonal influenza vaccine for this
Mm-hmm.
season, 25-26,
Mm-hmm.
and pneumococcal vaccine, which is the PCV20 vaccine. And influenza and COVID, if you have uh, 10 years or more, and you
Mm-hmm.
have a comorbidity or a predisposition for these diseases to get worse in
Mm-hmm.
you, I
Mm-hmm.
mean, diabetes, obesity, overweight,
Mm-hmm.
high blood pressure, heart disease,
Mm-hmm.
lung disease, uh, transplant, immunosuppression,
Mm-hmm.
HIV,
Mm-hmm.
uh, cancer, any of those, please go and get your vaccine,
Mm-hmm.
your vaccine dose this year.
Mm-hmm.
If you are a healthcare worker,
Mm-hmm.
also you have to be protected for you and your family and your
Mm-hmm.
patients.
Mm-hmm.
If you travel, if you teach in front of a group of people, if
Mm-hmm.
you have contact with a lot of people, with many people in your work,
Mm-hmm.
if you are in sales or I mean, in a taxi driver or
Mm-hmm.
I mean, something that is in
Mm-hmm.
contact with many people, it's
Mm-hmm.
also convenient
Mm-hmm.
that you have the protection of
Regardless
those
of
vaccines,
age. Regardless
regardless
of
of
age.
age. Yeah, it's
Okay.
almost universal. We cannot say that it's universal because there's no enough vaccine, but all
Mm-hmm.
these people, if you take care, I mean, if you are healthy, if you are a healthy adult,
Mm-hmm.
but you take care of your parents or
Mm-hmm.
a person which is vulnerable, it's
Mm-hmm.
preferable
You
that
get
you have the protection of the vaccines.
absolutely. Or you take care of small children too.
Absolutely.
Okay, well, there's the recommendations. I know there is the vaccines available in different parts of the city, and I believe it's available in some of the medical offices. But if you're in Mexico City, you should definitely, and you believe you need these vaccines, well, once again, just go to UNAM. UNAM, it's
Hmm.
it's it's in the parking lot of the stadium,
Of this, yeah,
and you will see it's clearly marked, and you will be able to have a chance to get all your vaccines and also take your loved ones or people that work with you. I mean,
exactly.
really, just make it an effort to be able to make sure as many people as possible who needs the vaccines can have access to these vaccines. Any final
Yes.
recommendations for this season, Dr. Mauricio Rodriguez
Well,
Alvarez from
just
UNAM.
just remind what we have learned during the pandemic. If you are sick, it's better if you use a face mask
Mhm,
or avoid to get around with other people in
mhm,
especially in closed places with poor ventilation.
mhm,
Try to promote ventilation, hygiene,
mhm.
and if you feel sick, try to rest, try to recover, go
Right.
for medical help
My son.
like your son
It's
did, and
and
protect your beloveds in your house. So
yes.
it's
Thank you. Thank you.
nothing new.
It's always great to have on our show Dr. Mauricio Rodriguez Alvarez.
Thank you. It's
He
always a
is
pleasure.
he's a medical doctor. He teaches at the medical school at UNAM, and we've known him throughout the years because he's been a spokesperson for UNAM University on different programs and projects. And of course, we know him during the COVID-19 crisis. We used to talk to him like almost every week, every other day. But it's always great to have you on the show. Thank you so much.
Thank you, Ana Maria.
Thank you. We're going to go to commercial break. I'm Ana Maria Salazar, and you're